Andrew Dennison.
Present.
Benjamin Vitale.
Present.
Grant Kyle.
Here.
Paul Pinckney.
Here.
Aileen McNabb Coleman.
Present.
Joseph DeForest.
Present.
Terrence Baxter.
Aye.
Joseph Bennett.
Here.
Frank Reginelli.
Here.
Patrick Mahoonic.
Here.
Timothy Lattimore.
Here.
Michael Didio.
Here.
Ryan Foley.
Present.
Keith Batman.
Present. Please rise to the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So I think the first order on our agenda is a proclamation. So if I could ask Pauline folks to join us up here.
Mr. Didio, too, sir.
So, whereas Pauline Coates Johnson is celebrating 90 years of an illustrious life, much of it spent highlighting the legacy of her Aunt Harriet Tubman through various advocacy efforts. And whereas Ms. Coates Johnson was born and raised in Auburn, she was the first African-American telephone operator for New York State Telephone Company in Cayuga County. She's been an active proponent to place Harriet Tubman on the $20 bill. She has been and remains an active member of the NAACP and the Harriet Tubman Booster Club. Whereas she was 26, she discovered she was the great-great-grandniece of Harriet Tubman and has spent the next 60-plus years traveling the U.S. and the world, spreading the news of her aunt's great deeds. Her efforts have not gone unnoticed. She's been honored with the Dr. Martin Luther King Jr. Memorial Award, inducted into the NAACP Hall of Fame, and recognized as a woman of distinction by Senator DeFrancisco. Her passion for preserving the rich history of her family, our community, and creating positive change has earned the respect and affection of all those whom she has come into contact. Now therefore, I, Keith Batman, Chair of the Cayuga County Legislature, and fellow legislators do hereby proclaim September 26, 2017 as Pauline Coates Johnson Day, and urge our residents
She also swore me in 4 years ago, so I appreciate that little token. Thank you very much. Let's go this way. All right.
We have two other proclamations that have been or will be delivered later. One is the Kinship Care Month proclamation and the Constitution Week proclamation. So we will not present those tonight. Okay, at this point in our agenda is our public to be heard. I know we have some fellow residents who wish to be heard. And I've asked that when you come forward, you state your name, your address, and please limit your comments to 3 minutes or so. After 3 minutes, I'll let you know that 3 minutes is passed, and I'll ask you to wrap up your comments at that point. So, if I may see, who would like to go first? I know there are 3 or 4 individuals.
Mr. Chair,
Yes.
I do have one public to be heard before. I know there's a lot of the nurses here. Kevin Jones is here to speak. He's in my district.
Very good. Is there a reason he needs to go first? So
Well, I think it's on
I
a
guess if
different
they're not here,
subject,
that's fine.
different subject.
That's fine. Yeah, come forward, Mr.
Basically, I'd like
If you would come up here, please. And
I'd just like to,
I'm sorry, if you could state your name and address for the record.
okay, yeah, my name's Kevin Jones, 4 Tuttle Square, Auburn, New York. And basically why I'm here is like the Jimmy Lattimore has been working on towards suing the county suing the opioid company, drug companies for the damages that they've done to our county. And basically it's something that they absolutely knew what they were doing when they did this. They had tests and things, you know, surveys, tests. They knew that drugs were addictive. They shoved it under the carpet, didn't want to talk about it, and sold it. Actually went out into the field. They got the Surgeon General to make pain the 5th vital sign so that they could sell more opiates. And more tests came out over and over and over again about how addictive it was. And they make the tobacco companies look like amateurs when it comes to what they did to the United States. And this county, you know, I can't even imagine 85% of the people in the prisons today are drug-related problems that are going on. And just this county alone, what we spend for the jails, what we spend in the hospitals, what we spend in our ERs being clogged up with drug seekers and all that type of stuff. We have a lot of actual, you know, damages that we can put down on a piece of paper, and we can say, this is what you owe us. There's already states that have already went forward and sued them successfully, so there's no reason that we should be the last time to get involved in this. And I don't see any downside to any of this, you know, and I'd like to see, rather than, if we did get something, rather than buying a bunch of new fire trucks, you know, let's go out and do something about the future problem that we're still having with this, because the numbers, the death rates are still going up. You know, they may not show much on paper because of the way that they're all, you know, the way that they register who dies of what, because there's other drugs in people's system. But the numbers of deaths are still going up, and the costs are still going up. And there's ways around this if we had money to put more money into treatment and prevention and things like that. You know, we could actually start saving the county some money if we put that money aside for that specifically. And that's basically all I wanted to address. I don't see any downside to this, and I hope that you guys get together and you decide to pursue this. Thank you.
Thank you. Please state your name and address, and I'll let you know when 3 minutes is up.
Okay. My name is Nancy Benton. I reside on Ira Hill Road in Cato, New York. First, I'd like to say good evening and thank you to Mr. Bateman and the Cayuga County legislators for allowing us to speak tonight on behalf of SEIU 1199 nurses. I've been a registered nurse at Auburn Community Hospital for 30 plus years. I was born and resided in this county my entire life, so this hospital is important to me. I'd like to address that the union has been in contract negotiations with Auburn Community Hospital since June. When we first met at the bargaining table with management, we made it pretty clear that staffing was our main issue and was at the forefront of this contract. Since then, we have met on several occasions with very little movement towards increasing staffing. Documented research has shown that improved patient to nurse ratios have lessened the length of stay in hospitals, reduced medication errors, falls, hospital deaths, and improved patient satisfaction, increased hospital reimbursement, and aided in the retention of bedside nurses, which in itself is costly to a facility to rely on travelers and to orient new staff. Times have changed, the demands on nursing has increased. Patients are sicker, their acuity is higher, electronic charting is more time consuming. And with all this being said, the staffing grids at Auburn Community Hospital have remained unchanged for at least 3 contracts, so that's approximately 10 years. Management response to increasing these is it is too costly. The 1199 nurses feel that with a small adjustment in the grids, our patients' quality of care would be improved, along with the job satisfaction and retention of nurses. Auburn Community Hospital services have also grown, as you have all realized in the newspaper and in our community. Along with this, nursing should parallel that. We at Auburn Community Hospital, the patients and staff are your family, your friends, and your constituents. So at this time, I would ask the legislators for your support as we move forward in our negotiations, and also to support safe staffing patient ratios in the legislation that they're trying to pass today. Thank you.
Can I stand out here? So,
But only if we can make jokes.
go right ahead, go for it. So, my name is Kelly Ruderman, and I'm from Shingle Valley Road in Genoa, New York, School District 8. And I have been a nurse at Auburn Community Hospital for 33 years. I've also been a member of the negotiating committee for the RN union for about 20 years, including the contract when the hospital negotiated the staffing grid that we have right now. The purpose of that grid was to establish minimum numbers of nurses per patients on the floor. And what happened was if the number of nurses fell below the number that was set by the grid, the nurses that were working would receive a premium pay bonus. Now, I worked on that contract. I know that the nurses who worked on that assumed that we would never make that pay, that the hospital would rather be aggressive in recruitment and retention of nurses and build the nursing staff up so that they would never have to pay that, and we would never have to be put in situations where we weren't giving the quality of care that we knew we had to give. Unfortunately, that has not been true. Since the grid has been established, as Nancy said, there's been a dramatic change in the duties of the nurse and the delivery of bedside care. These changes include what Nancy mentioned. If any of you have been in the doctor's office, if you've seen the use of computers and the doc is behind the computer screen while you're talking, it's the same thing at the bedside. We have to use electronic medical records, electronic charting of documentation of medication. We also have changed the technique that we administer nursing with the loss of the RN charge nurse. We've lost support positions like secretaries to take off orders, charge nurses to call physicians to get orders, phlebotomists to draw the blood. So all of these duties are falling back to the bedside nurse, while the number of nurses at the bedside falls and continues to fall. All of these things add to the workload of the bedside nurse, and all of these say to us that we need to address that grid. The nurses are struggling at the bedside every day to deliver the quality of care that their patients deserve, that your family deserves, that your constituents deserve. The nurses are burning out. The new nurses aren't staying. They're leaving. They're going to Syracuse, where they can have 5 patients on their load, or 4 patients, or 6 patients at the most, where the staffing ratios are better. Management tells us that there's a nursing shortage and that they're having difficulty recruiting nurses to Auburn Community Hospital. And we say that better staffing ratios is a recruitment and retention tool that will solve part of their problem that they're having with staffing at the hospital. As Nancy said, multiple studies support that adequate staffing improves patient outcome, decreases complication rates, even decreases death rates. Adequate staffing means your family get better care, the care that they expect and deserve. Better nurse-to-patient ratios equals better care improves patient outcomes, better patient outcomes increase hospital reimbursement, and better staffing increases nurse satisfaction. In the end, it equals a healthier hospital. It's that simple. When we surveyed our members prior to negotiation to see what was most important to them, staffing was number 1. Not raises, not more time off, not more perks. These nurses are at the front line of healthcare delivery in our community hospital, and their voices need to be heard. We need your help with that. Please add your voice to our cause. Please remember our concerns in your interactions with Auburn Community Hospital. Thank you.
Good evening. I would like to thank the county legislature for allowing 1199 SEI Youth Union from ACH to address you today.
So, I'm sorry, can
Oh,
you name and address?
Yep,
sorry.
Kenneth Spurgeon, 318 North Hoops, Auburn. So I realize that there are pressing issues facing this county, environmental, social, economics, so my remarks will be brief. We, the nurses of ACH, gather here today in this room and some outside. We're your neighbors, your friends, your relatives. We live and work in this county. We are the frontline goodwill ambassadors to people who seek care at ACH. Our goal here today is not to create division between management and the staff, but to create unity in our community to strive for healthcare excellence for the people of Cayuga County that seek it at ACH. The business model has previously been mentioned has changed dramatically since the inception of the staffing ratios approximately 10 years ago. The hospital has added several services: hemodialysis, interventional radiology with Strong Hospital, pain clinic, geriatric program, intensivist for the critical care area, a stroke center, and telemetry on every med-surg floor, to name just a few. The hospital also has acquired medical offices, gastroenterology, private practices, as well as the urgent care of Auburn that is in Central High, and is presently in negotiations for possible acquisition of the former Cayuga County Nursing Home. These are all welcome changes at ACH. We, the nurses at ACH, are excited for the future of our hospital and for our community. With that said, the acuity of the patients at ACH has increased dramatically. Since the advent of the guidelines 10 years ago, things have changed. The trend is to treat patients as outpatient as much as possible. Therefore, the patients that stay in the hospital are in most cases acutely ill, and in most cases needing significant care. The guidelines followed at ACH presently do not reflect that trend. There are national averages that are available to all to see. They're very easy to find. And they recommend a certain ratio for certain levels of care to patients to achieve the best possible chance to meet these patients' needs and have a positive outcome. The ratios are in place and followed in many, if not all, the hospitals in this region. Our proposal reflects similar numbers for ACH to bring us up to date with the current standards. We presently have been working more than 50% of the time below the guidelines established 10 years ago. More than 50% of the time we're short-staffed. In closing, I hope the legislature will see what the statistics prove and that the better ratios directly reflect a better patient outcome. And with the guidance of this legislative body, help ACH management to see the value and the quality it has in the nurses of Cayuga County that serve at ACH. For healthcare excellence for all, for us to seek. Thank you.
Thank you.
My name is Joe Malone, I live at 213 North Marvin. Some of you know me, most of you do here. President of Local 195 Auburn Police Department. When Kenny called me, obviously we're gonna back a local union, 1199. So I just want to make a brief statement for our members supporting their members. A couple of points I took from them: the retention. 3 years ago, our retention was awful. The morale will kill you, and you start losing quality people, you guys are going to have issues in that hospital, okay? I'm just telling you. That's what happened to us about 3-4 years ago, and we had to fix the problem. So listen to what they're saying. They wear many hats up there, those nurses. I work midnight for 12 days, you name it. I've seen it all. And we dumped some characters off to these guys. They're playing social worker, okay, domestic violence worker. They wear many hats, all right? Some people say, I don't want to do your job, Joe. Guess what? I don't want to do that job, okay? So listen to what they say. All right, our members came together with a little statement. I'll read to you, okay? We'd like to express our support of the 1199 as they bring attention to the growing need for stricter nurse-to-patient ratios in our hospitals. Our jobs share a similar quality in that safety concerns are directly related to staffing levels. As a police officer, nearly all of our training is based upon safety. And as professionals, we serve the public, we realize that safety isn't just about keeping ourselves safe, it's about keeping the people we care for safe too. The equation becomes simple. More nurses means better patient care. And although both of our jobs involve acting under situations of great urgency, we gladly accept that responsibility. We signed up for this because we all want to help. We all have the unique ability to act under pressure, and we all possess the desire to make people's lives healthier and safer. We understand and accept the fact that conditions are not always going to be ideal, and that a certain level of risk will always be involved as we provide our services. However, mitigating that risk and taking proactive and preventative steps to reduce the risk and improve safety and care is an option. We believe that the commitment everyone in 1199 made when they decided to become a nurse is unwavering. We know that despite low staffing levels, members of the 1199 give 110% every time they show up to work. We extended our support to them and joined their effort to raise awareness for their cause. Thank you.
I think we have one more speaker from tonight. Someone wanted to speak tonight. Oh, never mind.
Hello, good evening. I'm Teresa Hummany of 6950 Owasco Road. I'm a member of the Ignite Steering Committee. Ignite is a group of young professionals with Cayuga County and a program with the Cayuga County Chamber of Commerce. And we are here to talk about the event that we're promoting called Ignite the Vote. We want to encourage as many people as possible to vote on November 7th. And so we are hosting an event at the Hilton Garden Inn on October 10th, where we're encouraging as many community members of all ages to come and hear our representatives. We will be having the city council candidates and the county legislature candidates come and answer questions, discuss their stance, their roles. We are having them each talk for about 3 minutes to explain their qualifications, and then we're going to have an MC that's going to pose questions and that sort of thing. We have an online survey that we're collecting various questions from community members that we will be able to funnel